For months, we have reported on COVID-19 from the outside, the spike in numbers, the death toll, the orders from lawmakers, and the economic devastation. Now we take you inside to the front lines, to the first and sometimes the last line of defense. This is an inside look at the ICU at Swedish American and one of our heroes battling the most intense virus of our generation. This is the battle.
How much O2?
Fought inside the walls of the ICU at Swedish American.
Like 20% or less who need to be in the hospital. And from those in the hospital, some of them end up in our unit.
A battle against COVID-19 fought inside a patient.
Every day, almost every hour is a little challenging because of the virus. It goes from one extreme to the next.
One of the many fighters in this battle, Dr. James Stratton.
That's why this becomes a problem.
A pulmonary critical care doctor.
We support them until their body recover from that virus.
Each patient has a different battle, but the same virus inside of them.
They worsen rapidly. COVID patients worsen rapidly.
Their tallies on the windows show how long.
Day 25 in the vent. We're not sure if this guy gonna make it or not. He's not improving yet, despite everything we have.
A number each patient doesn't know, and each doctor and nurse does not want to see increase. Sometimes it's a losing battle against a virus that has already done damage.
If he dies, I hope not, but if he dies because of the complication of the virus, not with the virus itself. His lungs were kind of trashed. We're trying to clean up after the virus. This is a problem. And being on the vent this long is a problem.
It's also a changing battle.
In 1 month or 2 months, the whole practice guidelines changed, which put a lot of burden on staff, hospital supplies.
That hospital workers are learning as the virus develops, changing their battle plans.
It did increase a lot of challenges, of course. I mean, the workload is a lot higher than before. The degree of sickness is much more complicated than before.
Each time Dr. Zeter or any nurse goes in, a new set of PPE.
You change gown between rooms.
The special helmet seals off his face and pushes air out the back.
And we have young people, 21 on the vent, and we have 90 years old.
Because of COVID-19, Swedish American added 10 more beds to its ICU, and at one point, 24 of 40 patients were on ventilators. But Dr. Zeter hopes this is the peak, and he is seeing patients recover. Patients like Tasha.
She's off the ventilator. She is making progress. She's got a long journey ahead.
After more than a month at Swedish American, she is recovering.
Getting back to her new normal, it's going to be difficult. It's going to be a journey.
Other patients also winning the battle, like here in room 209.
This guy has no prior medical problem except nasal allergy, which we all have. No diabetes, no hypertension, but he got a bad infection. He was in the vent for 21 days. He's extubated now. He's confused, of course, but he's just on oxygen under his nose.
Room 211, a 79-year-old who received the first dose of remdesivir at Swedes, an experimental drug that seems to be working in COVID-19 patients.
We have to use it wisely in a way, so we use it for the one who would not survive without it.
Swedes only received enough to treat a few of them.
We're not going to use it for non-ventilated patients because we have short supplies.
Others are treated with convalescent plasma from patients who have recovered from COVID-19.
We try to use it as early as possible, as soon as possible, regardless of sick or not.
Tools to fight the battle.
Hello?
An interior battle.
Making progress.
A battle they are pushing to win inside the bodies of these patients and the walls of the last line of defense.
I'm hoping, my prayer, hopefully, this is not going to worse than this.
Swedish American does have a designated COVID-19 floor. It's the 10th floor, a special retrofitted unit with negative pressure rooms. Patients who need hospitalization but not ICU care go there first. Dr. Zeter says the number of COVID-19 patients on that floor and in the ICU are both dropping.